Hi, my name is Amanda. I'm from New Hampshire, and I've had long COVID since April 2020. In my youth, I traveled most of Western Europe and Australia before graduating in 2012 from Hofstra University with a degree in global studies. 2014 to 2016, I served as a Peace Corps volunteer in the Philippines in the children, youth, and family sector. I began working in the DC, Virginia area in 2017 as a government subcontractor for USAID. In 2019, I worked for the Lockheed Martin, working on U.S. Navy submarine systems when the first wave of COVID hit. Considered an essential worker during the lockdown, I reported to work where I contracted COVID and never recovered. We now call this long COVID. I went from a healthy person with no pre-existing conditions to being bedbound with debilitating and confusing symptoms that seemed to change with the weather. In a few months, I had lost my job and the attached health insurance and access to doctors. I lost my relationship when my partner thought I was faking being sick, and I lost my connection to my body. In the early days of my long COVID experience, it was about finding and convincing medical providers that I was indeed sick despite looking healthy from the outside. It was years of appointments and testing with doctors like my cardiologist that would blame my heart palpitations and shortness of breath on anxiety or on my weight rather than another medical condition. Finally, he caved after my second syncope event that landed me in the ER. In 2019, I ran the Cherry Blossom DC 10-mile race, added my COVID infection, and now at the age of 33, I spend my days alone, confined to my chronic fatigue sickbed, stuck in the brain fog of my mind, barely able to complete household chores. I live in my grandparents' basement because in the 3-year process of getting disability assistance from the government, I ran through all of my life savings and faced an eviction. Every savings bond and 401k account was emptied, keeping me and my cats alive while waiting on government assistance. In 2022, I attended a virtual symposium by the World Health Network that included various speakers from medical and scientific communities. One study reported that COVID survivors had a 10 to 15 times higher risk of considering suicide at 1 year than 11 million control patients. I have personally struggled with depression and anxiety my entire life. Before long COVID, I could count on one hand the number of times I had considered suicide. Now as a COVID long hauler, it's a thought on my mind every day. Suicidal ideation and dreaming of ways to end the suffering I experience in my body in this world every day. I have created a role for myself out of necessity. In all of my circles, I am an advocate and expert in long COVID. I have found online long COVID communities for advice and support. I don't know the answer to our current situation, but I know we aren't doing enough. People like myself who got sick in the first wave and the early strains of COVID have been waiting, screaming, and crying from our sick beds as we watch the world move on from a virus that is still killing and disabling thousands daily. We are losing hope that things will get better.
Hi, my name is Tammy and I'm from Pennsylvania. I have had long COVID since March of 2020. While I find it difficult to choose one of the many aspects of my 4-year long COVID journey, I really feel it's important to share with you something that is near and dear to my heart: accessing medical care in rural settings. I live in a small rural farming and coal mining community in the mountains of west central Pennsylvania. While the challenges to obtaining medical care that I have faced and continue to face may look different than maybe somebody who lives on a ranch in Wyoming, I feel the accessibility obstacles are very similar. My journey has made me realize how isolated we really can be in rural areas. Accessibility issues began with my first infection. The area that I live in didn't even have access to testing to confirm COVID, and I received a tentative presumptive positive diagnosis. This led to issues later in 2020 when I didn't get better and was seeking care because COVID clinics wouldn't take me because I didn't have a positive test result. And even if they did, the closest clinics were over 80 miles away. As 2020 moved on and I became more debilitated and bedridden, accessing care became more and more of a challenge. Not only was I too sick to make the long trip to a larger hospital for care, but telemedicine wasn't always accessible in our area due to poor internet and cell service coverage. This, coupled with a lack of knowledge and education in our isolated area, led to many missed medical issues, medical gaslighting, disbelief, and outright not knowing how to help. While many of my federal and state officials are working hard in 2023 and 2024 to bring internet and cell services to our rural areas, it is still a work in process. So, 4 years later, I am still traveling long distances to have a chance for some semblance of care for my ongoing long COVID. Please help us to petition for funding, awareness, and education to help all long haulers, but in particular those of us with accessibility issues. Thank you.
Hello, my name is Eileen. I live in Vermont. I've had long COVID since July of 2022. I had a wonderful career. At that point, I was working as a supervisor for some infant, toddler, and preschool classrooms. In fact, I'd been an essential worker teaching toddlers at the start of the pandemic. Very proud of that work. I was in great health, no prior conditions, feeling good, and had my first infection. It was a mild illness, in the sense that, yeah, I had a miserable few days in bed, but recovered and got back to what I thought was full health for about a month. A month passed and I became increasingly ill with chest pain. My heart was just beating erratically and having palpitations. I was losing a lot of weight and just feeling terrible. What I've learned in this time is that, the disbelief I had in the beginning of my illness to try to get my own medical provider to take me seriously, that I knew what anxiety was, and this felt different. My doctor continually told me that I was being too anxious and should ignore the data I was getting from my heart rate trackers that were advising me. They were concerned that my heart rate was higher than usual. I tried to get into the long COVID clinic and was denied multiple times because I did not have a doctor willing to refer me initially, and later when I did not have a medical home. In other words, I didn't have a doctor. I will say, as a side note, I have not been a part of the medical system a lot in my life. I've been perfectly healthy, and I was raised poor in a family that didn't believe in a lot of medical care. I've learned a lot about medical care and how it was denied to me, truthfully, when I needed it most. By the time I got into the long COVID clinic and physical therapy, by the time I found a new doctor to diagnose me with long COVID in January of 2023, I was already 87 pounds and needing medical leave. My chest pain was so extreme that I made my way to the emergency room multiple times, thinking for sure I was having a heart attack. This illness is debilitating. I have trouble standing and walking. I have trouble digesting food. Sometimes my head feels so swollen I can't think anymore. I lost my job. I was terminated and had 2 weeks notice that I was losing my health insurance. I thought I was going to die. I don't want to die. You don't want what I have. Help us.
Hi, my name is Grace. I'm from New Mexico and I've had long COVID since January 2023. After watching Law and Order starting in the first grade, I wanted to be a district attorney. I spent my life working toward and through law school. As I aged, my focus split into business and tax law too. I never in my life imagined no longer being a contributing, productive member of the human race. I have a vague memory of going to law school and graduating, and sometimes those stories return to me. Other times, I struggle to know or understand what is happening in that moment. I went from being able to read hundreds of pages of dense topics every day to now. I tried to read a 36-chapter, easy-read novel last spring, but gave up after a couple months. That was not a lack of interest in the story or a lack of time. It was the lack of ability to listen and process words for that long in an audiobook format. It was an inability to read, comprehend, and remember for that long in text format. My vision has changed. My ability to read has changed. I use an eye patch to help cover the wavy vision in one eye so I can see clearer. I read with my finger tracing the words so I can keep track of where I am. I went from being able to listen, think, and speak quickly on my feet in an argumentative courtroom setting to now. Now I must have my husband or my caregiver with me for any and all verbal conversations to run interference for when I get overwhelmed. Now I have a printout to hand to new people explaining my brain injury and lack of verbal skills. This is not who I ever thought I would be, let alone before I turned 40. That birthday was lost as another day in bed and housebound. I've been in speech therapy and cognitive rehab to help treat my cognitive communication deficit. This is where we learned my attention, focus, and memory have been severely damaged. I used to do taxes, math. Now I can no longer manage our personal finances. The damage to my memory, attention, and focus causes me to forget formulas or when and how to carry or borrow a number while doing math homework. This is the type of homework I did in elementary school. Back then, I got answers correct. Now, after 6 months of therapy, I continue to get answers wrong at 40 as a former business and tax specialist. I now have a home health caregiver, and I lose my voice, as you can hear. I have been isolated physically for my protection, and because I can no longer drive, I have been isolated socially, as well as my inability to communicate in any meaningful way on the spot. I have lost touch with my friends and family as life moves on for them, and I remain homebound.
Hi, my name is Monica Christopher. I live in Willowbrook, Illinois. I contracted COVID-19 on March 13th of 2020. Who would have known that almost 4 years later, tomorrow, I am still sick. I am still suffering. I am still dealing with all the ramifications of having the virus back in 2020. I am no longer able to work. I am no longer able to participate in my life the way I used to because of the many things that are wrong with me. Physically, my body cannot do half of the things or all of the things that I used to do back when I was healthy. We need help. We need answers. It's 4 years and we still have no real hope of what's in store for us. I personally have not been working since I got sick. That's 4 years with no income coming in. 4 years of no help from doctors because they don't really know what to do. Or they gaslight you and tell you, oh, we don't really know what it is. Or it's anxiety. Or it's depression. It's not anxiety and it's not depression. This is living with the disease for 4 years with no answers. This is doing all the right things, going to get vaccines, trusting science, and still we are suffering. We need help. We need answers. We need to be seen. We need to be heard. We need to know that someone is looking out for us, as this is not something that we caused. All we're asking for is for answers, for help, financially, medically, physically, and emotionally. We are hurting. And we feel ignored. We feel overlooked. This disease breaks up families because no one really understands it. No one really understands what we go through. We are not lazy. We are not depressed. We are not anxious. We are physically sick, and we need answers. This is the face of a long-haul COVID long hauler.
Hello, my name is Christina. I am from Florida, and I have had long COVID since February 2021. I'm very concerned about the lack of education and awareness around long COVID, and COVID in general, actually. This is very evident when you see news post articles about people with long COVID, and all the comments are laughing emojis and people saying it must be election season again, and people saying really horrible things to sick people who are trying to tell them, no, this is how it really is. And they can't understand because they've never been educated on this. I've had people in my own family They saw me in a coma on a ventilator. They saw me having years of therapies to get some semblance of normal. They see all the problems I have, and they still say it's a scamdemic. They still say it's a political hoax. They still say it's a 2-week cold. This is the longest 2-week cold I ever had, but apparently it's a 2-week cold. There needs to be more education, because if there was education, people would not be talking to sick people the way they do. You wouldn't talk like this way to someone who has cancer or someone who has lupus. Why? Because you know cancer and lupus really cause bad things. If you don't think long COVID causes bad things, of course you're going to think it's a joke. They need to be educated. They need to see what people with long COVID look like. They need to see what they live like. There are kids with this disease. There are teenagers with this. There are people who used to be bodybuilders. There are people who used to be personal trainers, mountain climbers. Now they can't get off the bed and go to the toilet. There's so many problems that anybody can get, and there's so little education out there, so that if someone does have all these problems, they don't know what's going on. They won't even think, maybe I should see if it's long COVID, because they don't know to see that. They need to be educated in a proper way. And I really hope that happens, mainly so that people who already have this can get help for it, and people who don't have it know how to prevent themselves from getting it, because I wouldn't wish this on anybody.
That mom. Before November 2020, I was that mom. You know the type I'm talking about. I was that mom that threw birthday parties that looked like I should be on every Pinterest board. Dr. Seuss, Sesame Street, Paw Patrol, Clifford, Winnie the Pooh, Very Hungry Caterpillar, and on and on. I was that mom that had the annual membership for Sesame Place, and I dressed my daughter up every time we went. I was that mom that would drive to Virginia if my son called and was homesick. I was that mom who worked at the daycare and nannied so I could be with my son. I was that mom that would spend my lunch breaks at my daughter's daycare and walk there if the weather was nice. I was that mom that had a girls' night out with my daughter every week. I was that mom that went to the zoo, DC, the orchard, museums, and family events. I was that mom that stayed every moment by my son's bedside whenever he was hospitalized. I was that mom that nursed my daughter until she self-weaned. I was that mom in every way. Now I'm trying to accept that I'm this mom. I'm this mom that ends up in the ICU 2 times after taking a relaxing vacation. I'm this mom that has to sleep all day so I can try to be present when my daughter gets home from school. I'm this mom that needs to sit or lie down when we play or do homework. I'm this mom that needs my son to correct my daughter's homework. I'm this mom that needs to limit and make accommodations for every outing. Rest days before, wheelchair, no driving, quiet breaks, clear schedule for crash afterwards, etc., etc. I am this mom that can no longer financially provide for my children. I am constantly grieving the mom I was. I struggle to accept the mom I am post-November 2020. This is the hardest part of long COVID for me. COVID didn't kill me, but it took my life. The life I had no longer exists, and it's not fair to my children.
Hello, my name is Becky Moore, and I have long COVID. I have had this disease for 4 years, and I compare my journey to being a prisoner of war. With grueling pain, unknown treatment, and little hope, I often think, how did I get here? And why are so many people suffering without limited knowledge, acknowledgement, government support, and treatment? I then remind myself that I have been an underdog all my life, fighting for those who can't. A future of good health, planned events, and energy to live The best years of my life are gone. What stands before me is a daily struggle with no hope, no answers, and everyday pain in which I fake being well so that I can have some existence. If you can imagine, you could have a sprained ankle or a broken foot, and the pain is terrible, but after a few weeks and treatment, it is gone. With long COVID, you wake up, and the pain has moved to your shoulder, or to your nerves, or to your head. It is like being chased by a wild animal that you cannot outrun. It is beyond your ability to understand unless you are living it. I will never forget the day I found the Long Haul Advocacy Group on Facebook, and I had some reassurance I wasn't alone, and it wasn't all in my head. I am tired, I am weak, and I want to think of anything but long COVID right now, but I can't, because I am not willing to let this disease take me as it has others without fighting as hard as I can. I lost my upper teeth through long COVID. I lost my gallbladder. I lost years of my son's life. I've lost years of being a wife. I lost my job. I lost friends. But I'm continue to fight for cures for us and so many that are suffering. Thank you for your time.
Hello, I am Susan from Alabama, and I have had long COVID since June of 2021, and my first symptom after the initial infection was severe depression, which led me to be diagnosed with severe reoccurring major depressive disorder. And while I was off work dealing with treatment for my depression, I did develop physical conditions as well. The first was shortness of breath while walking short distances, and also weakness in my muscles and severe fatigue and brain fog, and also heart palpitations and high blood pressure, which caused me to have to prolong my leave from work, which eventually led into me losing my job because I was not able to do it. So I'm no longer able to work as of now, and so far I have been diagnosed with reoccurring or severe reoccurring major depressive disorder, chronic post-COVID fatigue, chronic post-COVID shortness of breath, and chronic post-COVID neurological symptoms, and POTS, and heart palpitations, and high blood pressure, and recently I was diagnosed with small fiber neuropathy. And since I can no longer work, and me and my husband are not eligible for financial help, we are financially limited to what treatment and medications I can afford. So, and I'm unable to get disability. So, my health is still poor since I am not able to get the treatment that I would be able to afford if I was still working.
Long COVID has completely changed my life. I was a medical assistant for over a decade. I thrived in caring for others. I would do anything in my power to help anyone if they needed it. Working in healthcare is challenging, so it was always my goal to make others around me laugh and smile. Great multitasker. I would run on my lunch break, work overtime, 8 months pregnant, go to the gym. I just really miss the person I used to be. The worst part is the mom guilt of what kind of mom I was before. An active, fun mom. And my second son does not get the same mom my first son did.
You did it?
I still have hope I will feel better one day. I have symptoms, a lot like a roller coaster, but I'm hopeful. It's very stressful to not know how to provide for your family or yourself. Flares are worsened by stress and not having any financial means is really hard. I pulled out all my retirement fund. I've been denied SSDI, constant shut-off notices, and late rent. There's so much to say about long COVID, but I don't even know how to say it anymore. Thanks for watching.